Welcome back to Day Break. About 13 minutes until 8 o'clock. The music's got you
I know, I feel like
flowing.
Yeah. It's what it is when you're living on an island. You just like, you know. I don't know what I just said, and okay, so let's talk about back injuries.
Yes, it is one of the most common injuries, particularly the lower back, and physiotherapist Christine Gibbs has information that will help alleviate that pain.
Good morning. I'm Christine Gibbs from A Step Ahead Physiotherapy in Governors Square. Thank you for joining me for another segment of Staying a Step Ahead. One of the most common areas of pain I see in the clinic is the low back. Often people come to me not knowing why their back hurts. They say they just woke up in pain or bent over to pick up the remote control. Most back pain is the result of everyday activities. These activities, coupled with poor bending technique and too much prolonged sitting, add up over time to produce pain and stiffness. You know, the straw that broke the camel's back scenario? The good news is that most back pain can be managed or alleviated by changing certain key habits and physical imbalances. Today, I'd like to give you my top 10 tips to manage or banish back pain and prevent future episodes. Number 1, don't get hung up on what hurts. If you want to reduce or eliminate your back pain, you have to discover what you've been doing to have brought it on in the first place. Many patients think expensive scans are a necessary step towards curing the problem. A scan is not a treatment. It is far more useful to concentrate on the cause of back pain and eliminate that. Number 2, medication and ice. You should not need to take painkillers or ice your back to get through the day. Pain is your body's way of saying something is wrong. Listen to it. Tablets and ice are simply numbing and masking the pain, not fixing it. Number 3, posture. The way you sit, stand, and even lie down affects the forces on your low back. The key to good posture is symmetry, keeping weight over both feet when standing and both sit bones when sitting. Make sure you're not leaning or slouching. Number 4, flexibility. The two key muscles involved in back pain are your hip flexors and the hamstrings. So tightness in the front will cause your pelvis to roll forward, tightness in the back will do the opposite. So to stretch these, get down on one knee, lean forward, really getting a stretch to the front of that hip. Hold for 30 seconds, and then to get the hamstring on this side, slowly come backwards, keeping the knee slightly bent, and you'll get a really good stretch through the back of that hamstring. And again, hold for 30 seconds. Number 5, strength. To get a big bang for your buck, grab a ball. Get on your knees. This is going to work the abs and the glutes. Hands on top of the ball. Slowly extend out. You'll start to feel your abs contract and your glutes. You want to only go as far as you can without sagging. So if you need to go nice and slow, stop as soon as you feel your hips and glutes start to sag. And then flip over. You want your head and shoulders on the ball. Feet shoulder width apart. Come up and squeezing your bum. And number 6, foam roller. This is going to be your best friend. Thoracic spine mobility up through the center of your back is key in back pain. Grab a foam roller, lift up your hips, and roll up and down. You'll probably feel some pops and cracks. If you feel a spot that's particularly tight, raise your hands and really get a good stretch over the foam roller. Number 7, core. There are lots of fancy ways to work your core, but most of us totally miss a muscle called the transverse abdominis. It's the deepest of your core muscles, and it functions like a corset. It anticipates motion and is vital in core training. Notice I said training and not strengthening. This muscle must be trained to activate to protect our spine. To train this muscle, lie on your back. Put your fingertips right inside your hip bones. Imagine a line drawing across your belly and just gently squeeze it. Your fingertips should not pop up. You should just feel a deep, light pressure. Breathe through the entire exercise and hold 3 to 5 seconds. Number 8, proper lifting. Keep the object close to you. Use a neutral spine and bend with the hips, knees, and ankles. You want to pick up from underneath if possible and lift with your legs. Nice and close, lifting with the legs. And number 9, lose weight. Excess weight increases the force on your body and spine. It shifts the center of gravity, which causes changes in your pelvis and spine alignment and function. So if you have a large belly out like this, it's going to draw you forward. So losing weight will bring the center of gravity back to center. And number 10, buy quality furniture. Most people spend 6 to 10 hours lying in bed overnight. It makes sense to invest in high quality bed and pillow. The same holds true for your desk chair and your couch. Don't skimp. I hope these top 10 tips have been helpful in showing you a variety of exercises and suggestions for how to keep your back pain and injury free. These tips are meant for minor, occasional back pain or for anyone seeking back pain prevention. Thanks for tuning in. Join me next month to continue staying a step ahead.
Really like that last tip, buy quality furniture. It's not one that you think about, although I do need to continue to work on my posture. Well, if you'd like to get in contact with Christine or the team at A Step Ahead Physiotherapy, you can give them a call. That number is 745-ASAP. That's 745-2727.
You can also send them an email to info@astepaheadphysio.com.
Of course, you can also visit their website. That is astepaheadphysio.com.
And their offices are in Governor Square. You can stop by there as well.
All right.